Hello, True Health Seekers, and welcome to another exciting episode of the Learn True Health podcast. If you're someone who wants to learn how to prevent heart disease, or maybe you have been told by your cardiologist that you have some blockages or you're moving towards having blockages in your heart, then today is absolutely the interview that you need to hear. My father died of a heart attack. His heart actually, they told me his heart exploded in his chest. But that graphic image in my mind solidified my mission to help as many people as they can to prevent disease naturally and to reverse disease naturally. And today, I have with us a cardiologist who, for over 40 years, has been helping his patients to reverse heart disease naturally with only diet. Now, I've had two other cardiologists on the show before, so I think it would be worth it for you to also listen to them. I think listening to my guest today, very famous all-natural cardiologist, and also the other two, it would give you a well-rounded information. What's interesting, though, is that they all contradict each other in certain aspects. So now we have to decide which program is the best for us. Well, my guest today has the longest standing track record of success. So I do love the other two cardiologists that I interviewed, and I think they're all worth listening to. The first cardiologist would be Jack Wolfson, Dr. Jack Wolfson. That was episode 101. And he saw patients suffer over and over and over again until he was introduced to natural medicine. And he saw the light and he realized, wait a second, I don't need to wait until I put stents in and give drugs to manage someone's ill health. I can help someone to actually achieve health and build their body naturally. And so he recommends diet and supplements, focusing on more of a paleo style diet. And he gets great results. Second cardiologist that I interviewed is episode 167, and that is one of my favorite authors, Dr. William Davis, who wrote the book Wheat Belly. Amazing book, highly recommend it, and a great interview. He's very easy to listen to and brings a lot of common sense when explaining why his diet and some supplements are recommended for preventing and reversing heart disease and other diseases. And he focuses on a diet that supports a normal, a stable, and low healthy blood sugar. And he explains why that can reverse and prevent heart disease. Now, today's guest has, like I said, the longest track record and published the most amount of studies. In fact, he did a study over 12 years where he observed patients who had many blockages in their heart, some on death's door, following his dietary protocol. And after 12 years, the results were remarkable, unbelievably remarkable. And he shares that today in our interview. So if you have a family member who has high blood pressure, who has had to have stents put in their heart, who is on some kind of cholesterol medication, they need to listen to today's interview. Now, I have known about this doctor because his books are quite famous in the natural health space. However, when I discovered that he was one of the doctors that was interviewed for the series I Thrive, which is about to be launched. I'm very excited. In fact, by the time you're listening to this, it may already have launched. It's a free docu-series where we follow a man who is in his mid-50s and he is tremendously obese and has heart disease and diabetes. And he goes to these natural doctors and follows their protocols, and the cameras follow him, and he reverses all of it. And then we learn through this docu-series how we can apply these all natural steps, the dietary steps, and when needed supplements as well, to support our body's ability to heal itself so we do not need the assistance of drugs. Most people can get to the point, can heal their body to the point where they don't need drugs, and this is what these doctors say. And this is what they show in this docu-series. So if you are excited for today's interview and you love today's interview, you will be blown away by this docu-series. And I want you to watch it for free. I'm going to be watching it. I'm going to be glued to it. And I definitely want you to join me. It's called I Thrive. You can go to learntruehealth.com/I Thrive. put in your name and email, and you will have free access to watch it when it launches in a few days. And go there anyway, even if you're listening to this and it's a year from now, because they often will do relaunches and you can watch it for free when they do relaunches, or if you'd like to buy the entire series because you want to share it with friends or family, you can do that as well. So it's learntruehealth.com/iThrive. And the link to that is also going to be in the show notes of today's podcast. So if you're driving and you can't get to the website right now, just know that the link's going to be there so you can click on it later and put your name and email address in and then watch the docuseries when it comes out. So this doctor, this wonderful cardiologist who for over 40 years can reverse multiple blockages in the heart with just diet. So incredible. I'm so inspired by him. He is one of the wonderful doctors that's in this docuseries. And so you are going to love it. You're going to love I Thrive, and you're going to love today's interview. Please share this interview with as many people as you can, especially those who know who are up against it when it comes to their heart health. We need to be able to support each other by bringing the information that really makes a difference. I can't save my dad. I can't save my mom from cancer. I can't save my dad from heart disease, but maybe I can save your dad, or maybe I can save your son, or maybe I can save your uncle or another, or your husband or a loved one, or women suffer from it too, so I can save your mom or your grandmother or your sister or your best friend by sharing this information. So thank you so much for being a listener of the Learn True Health podcast. Thank you so much for supporting us by sharing this information. And sign up for the free docuseries I Thrive by going to learntruehealth.com/iThrive. I'll see you there. Enjoy. Welcome to the Learn True Health podcast. I'm your host, Ashley James. This is episode 232. Today, we are in for such a treat. We have with us an amazing doctor and healer. I love his books. His book on prevent and reverse heart disease is something that is so recognizable. If you've seen this cover once, you've seen it 1,000 times because it's on a bestsellers list. It's always in the bookstores. It's always pops up for me on Amazon as a recommended reading. It's considered the Bible of holistic health when it comes to healing and preventing heart disease. Dr. Esselstyn is amazing. What I love is that he is a pioneer, that the diet that he preaches for reversing and preventing heart disease is now just catching on in the mainstream, and he's been teaching it for so many years. It's such a pleasure to have you on the show today.
Thank you for your invitation. I'm looking forward to it.
Absolutely. I was just really, really thrilled to have you on the show because so many of our listeners want to learn how to reverse disease. They want to learn how to prevent disease. And the biggest question is, what should I eat? We have all these choices now, and we just don't know. We don't know what to do. A lot of people still just go drive through the drive-through and don't think that what they put in their mouth has any effect or impact on their health. Even though we know that's kind of foolish. Of course it does, because it's the fuel that fuels our body. But we're not taught in school what to eat. We were taught maybe the pyramid, right? Back in the 80s, we were taught to eat the food pyramid, lots of grains, lots of meat, maybe some vegetables in there. And of course, anytime you hear talk against eating meat, then the big agra comes up against it and wants to promote eating meat. So the big question on everyone's mind is, what do I eat for health? And so many doctors don't even know themselves because it's not taught in medical school, the appropriate diets and nutrition. And I know with all the research you've done, you've uncovered the exact way, the blueprint of perfect heart health that we could all follow to live long and healthy lives. And I really look forward to teaching that today to our listeners. But first, I'd love for you to start by sharing your story, because I think that'll give us great context. What led you to become this doctor, this healer, and this author that you are today?
Well, Ashley, I went through Yale as an undergraduate, and then I went to medical school at Western Reserve University School of Medicine in Cleveland. And then I went for my internship at the Cleveland Clinic in Cleveland, Ohio. And that was when I made my decision to go into general surgery. And After I finished my training, I had a 2 years in the Army. The first year was at Fort Bragg, North Carolina. The second year, I was a combat surgeon in Vietnam. Returning from Vietnam, I was offered a position in the Department of General Surgery at the Cleveland Clinic in Cleveland, Ohio. And eventually, somewhere in mid-career, I was chairman of our breast cancer task force and head of the section on thyroid and parathyroid surgery. Now, I know it sounds a little bit unusual for a general surgeon to have an interest in nutrition, but what occurred in my career was halfway through, I decided that I was increasingly disillusioned with the fact that for no matter how many women I was doing breast surgery, I was doing absolutely nothing for the next unsuspecting victim. And that led me to a bit of global research. And it was quite striking that there were multiple cultures where breast cancer rates were 30 and 40 times less frequent than in the United States, such as Kenya. And in rural Japan in the 1950s, breast cancer was very infrequently identified. And yet, as soon as the Japanese women would migrate to the United States, by the second and third generation, still pure Japanese American, they now had the same rate of breast cancer as their Caucasian counterpart. Perhaps even more prostate. For example, in the entire nation of Japan in 1958, how many autopsy-proven deaths were there from cancer of the prostate in the entire nation? 18, the most mind-boggling public health figure that I've ever encountered. Now, by 1978, they were up to 137, which still pales in comparison to the 28,000 men who will die this year in this country from prostate cancer. So somewhere along the line, I then felt that there would be much more bang for the buck if we could look at the leading killer of women and men in Western civilization, which is cardiovascular disease. And the reason was that in this global review, I was encountering multiple cultures where cardiovascular disease was virtually non-existent, and that they were characterized by whole food, plant-based nutrition without oil. And therefore, the dream was, quite simply, if we could get people to eat to save their heart, they would also be saving themselves from the common Western cancers of breast, prostate, colon, and perhaps pancreatic. So that was sort of the background. And then I decided I would really have to do this study, this trial. And since I was active as a surgeon, it was going to have to be a small trial because I had all my surgical obligations that I had to continue. And so I went to the Department of Cardiology. This was after my wife and I had done this for a year. Went to the Department of Cardiology and asked for 24 patients with significant coronary artery disease. And now the rock upon which I was most concerned that this study would flounder would be lack of patient compliance. And I was not a trained psychologist, but I decided that I would use as the mantra for these patients the same that I had used for my cancer patients, which I had learned years ago from a wonderful West Coast surgeon by the name of Bert Dunphy. And Bert used to say that patients with cancer are not afraid to suffer, and patients with cancer are not afraid to die. But patients with cancer are afraid of being abandoned by their family or their physician. So for the first 5 years of this study, I saw every one of these patients in my office every 2 weeks, drew their cholesterol, and checked their weight, their blood pressure, and went over every morsel they had eaten. At the end of 5 years, I was a little bit more courageous, and I stretched it out to every month. And then at the end of a decade, they were pretty well on autopilot, and I was able to string it out to quarterly. And then at the end of 12 years, it was time to write up this group, because most of these studies are no more length than usually 3 or 4 years. And here we were at 12 years, which really made it the longest study of its type in the medical literature. And we began seeing some very striking things happen to these participants who were, number one, they began to lose weight. Number two, their symptoms began to disappear. And when we carefully studied them, they were actually reversing their disease. So that's how this all got started. And they were sick. I mean, they all had triple vessel heart disease. As my late brother-in-law said, these were Essies walking dead. And they had failed their first or second bypass. They had failed their first or second angioplasty. They were too sick for this procedure, or they had refused. 5 were told by their expert cardiologist they would not live out the year, and those 5 made it beyond 20 years. So that was how this all got started.
That's really exciting that working with those patients, that you're able to see such incredible results and such long-term results, and you're able to publish those findings. Can you share with us, what program did you put them on? Did you put them on a bunch of medications, or were you helping them with was diet the number one contributor to their recovery?
Well, the thing that was interesting, all of these patients obviously were being cared for by expert cardiologists, and they had what was at that time, back in 1985, before the appearance of any statin drugs, they had the usual cocktail of drugs, which has absolutely nothing whatsoever to do with the causation of the illness, but just trying to treat symptoms. And the diet that I chose was essentially extracted from those nations where the disease is virtually non-existent. For example, if you were a cardiac surgeon and you were going to hang out your shingle in Okinawa, rural China, the Papua Highlands in New Guinea, Central Africa, or the Tarahumara Indians in northern Mexico, forget it. You better plan on selling lollipops. Why? Because you're not going to have any surgery there. Those cultures do not have any cardiovascular disease. Why? They all thrive on whole food, plant-based nutrition. And so that was, in essence, that was the type of nutrition that I was asking these patients to follow. And now, at this point, I probably should explain a little bit of the physiology of where all experts agree that where this heart disease has its inception, its start, its beginning. It's not your genes, it's not your stress, but it is the nutrition. And where this disease has its onset, its inception, its beginning, is when we progressively injure the life jacket and the guardian of our blood vessels, which happens to be that delicate innermost lining that has a name. It's called the endothelium. And the endothelium manufactures a truly magic molecule of gas, nitric oxide, which is responsible for the salvation and protection of all of our vasculature because of its remarkable function. For example, number one, nitric oxide keeps all the cellular elements within our bloodstream flowing smoothly like Teflon rather than Velcro. It keeps things from getting sticky. Number two, nitric oxide is the strongest blood vessel dilator in the body. When you climb stairs, the arteries to your heart, the arteries to your legs, they widen, they dilate. That's nitric oxide. Number three, nitric oxide protects the wall of the artery from becoming thickened, stiff, or inflamed. Protects you from developing high blood pressure, hypertension. Number four, now this is the absolute key. A safe and adequate amount of nitric oxide will protect you from ever developing blockages or plaque. So literally everybody on the planet, whether they're from Berlin, London, Chicago, New York, Little Rock, Little Rock, or Houston, if they have cardiovascular disease, it's because in the preceding decades, they have now so sufficiently trashed, injured, and train wrecked their endothelial system, they simply do not have enough nitric oxide to protect themselves from developing plaque and blockages. So, what indeed are the foods that every time they pass your lips, you injure the capacity of your endothelial cells to make nitric oxide? They are: one, any drop of oil, olive oil, corn oil, soybean oil, safflower oil, sunflower oil, coconut oil, palm oil in a cracker, oil in a piece of bread, oil in a salad dressing. Oil injures the endothelial cells, as does anything with a mother or a face: meat, fish, chicken, fowl, turkey, and eggs, and anything that is dairy: milk, cream, butter, cheese, ice cream, yogurt, and sugar. That is, diet drinks, Pepsis, Coke, cakes, pies, cookies, stevia, agave, excesses of maple syrup, molasses, and honey. And when you eliminate those foods, the endothelial cells begin to recover. See, the nice thing about this disease, it is not a malignancy. And once you stop at all injuring the endothelial cells any further, they begin to recover. And you make enough nitric oxide so you not only stop the disease, but often you see elements of disease reversal.
My mind is blown. You mentioned stevia. So stevia is not safe. No, it doesn't. There's no calories to it, or it's that sweet, a natural sweetener from a plant. But that also affects the endothelium.
What you're trying to do with these patients is obviously they're down regulating two receptors. They're down regulating their fat receptor in their brain. They're down regulating the sugar receptor in the brain. Now, that's pretty darn important, and that's why somebody says, "Well, why don't you do this gradually? Why do you always do it cold turkey?" Well, if you have somebody who tries to do this, say, during the week, but on the weekends they're going to make an exception, that's just terrible. That's the worst thing you can do, because what happens then is that you do not downregulate the fat receptor. You still have this craving for the Western foods that are going to injure you, and then there is recidivism or failure. And the same thing happens with the stevia. Stevia so incites the sugar receptor that it's just never going to work.
Oh, I understand. So stevia doesn't affect the endothelium, but it affects the receptors in the brain. And what we're really trying to
Yeah.
do is help downregulate that craving for sugar. Now, what about fruit? What about eating an orange? Is fruit okay on your program?
Yeah. Fruit. If you eat fruit as fruit, not fruit juice. See, when you eat an orange or an apple, what you're doing is you're getting the fiber. The sugar is bound to fiber, and that's safe. The absorption is slow. When you make fruit juice or apple juice, whatever, and you separate the fiber from the sugar. Now, suddenly, when you drink juice, for example, and when it hits your stomach, it's like a rocket going off. It injures the liver, glycates protein, and injures the endothelial cell.
Fascinating. Now, what about omega-3? There's this a lot of buzz about how omega-3 is anti-inflammatory and thus good for cardiovascular health, but omega-3 supplements are oil. What do you think about that?
Well, first of all, I wouldn't ever take omega-3 as a supplement, except in the following manner. Um, the omega-3 is generously found in green leafy vegetables, which should be a hallmark of this type of food, and I'll talk about that in a minute. And in addition, we like patients to take maybe a tablespoon or two of either flaxseed meal or chia seeds on their cereal, which helps with the omega-3. And it's extremely unusual to ever hear of somebody who has any kind of clinical symptomatology from being low in omega-3.
Oh, especially if they have it through flax and chia, that's a wonderful source. Do you have
Yeah,
any
how many?
other recommendations to how to get healthy fats in their diets if they're when they cut out all the oils and all the animal products? What other
Whoever said
recommendations?
that? Yeah, but whoever said that eating all those oils was ever healthy? I mean, the olive oil companies will certainly say that they're healthy. But what do you get when you're drinking that oil? You're getting 120 calories per tablespoon, and it's just fat. There is no mineral, there is no fiber, and then once in a while a minuscule amount of a vitamin. What are you getting? You're getting fat, and that fat, has been shown to destroy and injure the endothelial cell.
Mm. Are there healthy sources of fat like nuts and seeds, and
When we
avocado?
when we did our original group of patients, and we calculated how much fat they had through their diet diaries and so forth. They were following exactly this plant-based program. They're eating 11% fat, which is plenty of fat. Have you ever heard of anybody who went to an emergency room and said, "My God, help me out. I'm fat deficient." I mean, it's kind of crazy. Now, going back to what I want these patients to be able to eat are all these marvelous whole grains for their cereal, bread, pasta, and rolls and bagels. 101 different types of legumes, lentils, and beans. All these marvelous red, yellow, and green leafy vegetables, and some white potatoes, and especially sweet potatoes, which are very nutritious, and some fruit. Now, there's another thing that we have changed just in the last 6.5 years that is not in my book that I'll mention now. And that is when I see a patient with heart disease, especially those with symptoms of angina and so forth, chest pain, I ask them to imagine if they could get their head inside those arteries going to their heart, the coronary arteries. If they were looking at that plaque, they would see that it is an absolute cauldron of oxidative inflammation. So we need antioxidants. Therefore, you're going to get your antioxidants from food. Fair enough. What food? Food that is high in what we call ORAC value, ORAC, oxygen radical absorptive capacity. So that means if you're having raspberries, blueberries, strawberries, and blackberries on your oat cereal in the morning, that is terrific. But nothing can trump the antioxidant value of green leafy vegetables. So for these patients, I need them to chew, not smoothies, not juicing. I need them to chew a green leafy vegetable roughly the size of their fist after it has first been boiled in water, 5.5 to 6 minutes, so it's now nice and tender. And then they must anoint it with several drops of a delightful balsamic vinegar. Why? Because the balsamic vinegar has acetic acid, which will restore the capacity of the endothelial cells nitric oxide synthase enzyme, which is responsible within the endothelial cell for making nitric oxide. So I ask these patients, therefore, to have this 6 times a day. I want them to chew it alongside their breakfast cereal, again as a mid-morning snack, again with their luncheon sandwich. That's 3, mid-afternoon, 4, dinner time, 5, and of course I adore it when they have that evening snack of kale, number 6. What are they doing? All day long, you are basking and bathing that horrible oxidative cauldron of inflammation with nature's most powerful antioxidants. And what are the green leafy vegetables I'm talking about? They are bok choy, Swiss chard, kale, collards, collard green, beet greens, mustard green, turnip greens, Napa cabbage, Brussels sprouts, broccoli, cauliflower, cilantro, parsley, spinach, and arugula, and asparagus. And the top six are kale, Swiss chard, spinach, arugula, beet greens, and beets.
That sounds delicious. I love vegetables, and I didn't always love vegetables, but it's doctors like you that make me appreciate and love vegetables. And I did a sugar detox a few years ago. I've reversed my own type 2 diabetes naturally using food and some mineral supplements. And what I found when I did that, like you said, downregulate the sugar receptors, is that all of a sudden, vegetables became the most delicious thing I have ever tasted. And before that, when I was eating the standard American diet, vegetables were bland and disgusting. But like you said, when you downregulate the sugar receptors, something happens and this shift happened. And it's like I'm eating candy. Have some lightly sauteed beets and kale and cabbage. And it is like eating succulent candy. It's so delicious. Now you said boil. Is there a particular reason why you want them to boil their vegetables instead of steam or lightly
Yeah, when
saute?
you try eating turnip greens raw. No, not only is it tastier, but also I think there is uh, data to suggest that when you begin to break down these cell barriers, it makes the availability of the phytonutrients that are contained therein much more uh, available.
Now, you had mentioned grains, and that's kind of a controversial topic now. A lot of doctors are saying that they notice a much healthier patient when the patient goes grain free or gluten free. But you're saying that whole grains are good for heart health.
Well, that certainly is whatever the experience of others that you mentioned. That has not been our experience at all. And when you think about it, as a matter of fact, that's been the staple for many of these economies, whether it's corn and some places of the globe, and it's wheat, and others areas it's rice. I mean, that's been their staple for centuries. And there are going to be maybe something like 1% or less of the population that has a true uh, celiac disease and gluten problem, but well, grains are really, I think, pretty powerful.
Got it. And you'd mentioned that there's so many legumes to choose from, which is an amazing source of protein. I believe it's 18 grams of protein in 1 cup of legumes. What other sources of plant-based protein do you like your patients to be on? Can they be on soy? Do you find soy, obviously non-GMO soy, hopefully organic, but do you find that soy is healthy for heart health? Are there any other um
I think so much protein in all the foods, generally in there's protein in grain, there's protein in beans, and that is legumes. There's protein in vegetables, and there's protein in potatoes. How many times have you heard of anybody who was on a plant-based diet who went to the emergency room and said, "My God, help me out. I'm deficient in protein." Happening. I mean, you have Kyrie Irving, who is an absolute star basketball player, who is just better than ever, and everybody wonders where he gets all his energy and stamina. And he very clearly says it's ever since he switched to plant-based nutrition. Not only does it increase stamina, but it greatly shortens the recovery time. And I think there's something like 10 members of the Tennessee Titans professional football team that have gone into plant-based nutrition. The strongest human being on the planet is a German Baboudian who is plant-based. So it's yeah, not a
Wow.
problem. I mean, when you think about it, you want somebody who's got a lot of muscle. Look at the bull in the meadow who's trying to service these cows. What does the bull eat?
Exactly, right. The animals get their protein from all
It's a pretty
the grass
big,
and
strong guy. What does the
yeah.
elephant eat?
Yeah, all the vegetables.
Right.
Now, we talked about heart health. What about other cardiovascular events like stroke? Have you noticed that you can reduce occurrence of stroke and help someone recover faster while eating this diet?
Well, I think you make an interesting point because one of the things that has emerged in the last 30 years that we've been involved with this is that increasingly you encounter other kindred spirits who are medically into this as well. And although it hasn't been published, there are just multiple anecdotal events that really make it appropriate to say that perhaps medicine has never before had such an incredible tool in its toolbox. And by that I mean, when you're treating a patient for heart disease, what do you suppose happens to their hypertension? Their high blood pressure goes away. What happens to their obesity? Goes away. What happens to their diabetes? Goes away. Their high cholesterol goes away. Their risk for stroke goes away. The risk for vascular dementia goes away. In other words, all the other diseases that it seems to profoundly affect are things like Crohn's disease, ulcerative colitis, rheumatoid arthritis, lupus, multiple sclerosis, allergies, asthma, kidney problems. I mean, the list goes on. 75 to 80% of chronic illness need never, ever exist.
It's so
And here you
fascinating.
are, you do this with food that looks delicious, tastes delicious, smells delicious, and what does it do? It restores and improves your health. See, the problem right now with the Western diet looks delicious, it smells delicious, it tastes delicious, and the hideous thing about it is, as it is absolutely destroying you, it is painless.
Mm-hmm. Yeah, I just high blood pressure is the silent killer, and so many people get on high blood pressure medicine. I was just talking to my doctor about this recently. She said people will do dietary things to cause high blood pressure or lifestyle things like drinking too much coffee, being dehydrated, eating the wrong foods. And that's like throwing gas on the problem. And then they take a medication like high blood pressure medication that just artificially lowers it, but they're still throwing gas on the problem. It's like they're still throwing gas on the fire, and then they're, taking a blood pressure medicine to throw a little bit of water on the fire, but that's not really addressing the root cause, so they're still killing themselves, with their diet and lifestyle, and the medicine isn't actually going to do any good in the long run. It's just going to, artificially lower the blood pressure while they're still killing themselves with their diet and lifestyle.
How many people do you know over the age of 60, 65 who aren't taking a pill?
It's very few.
Right, it's Farmageddon.
I heard that 70% of the adult population in the United States is on at least one prescription medication.
Yeah, yeah,
It's
it's
it's incredibly sad. Now, talking about medication, what are your thoughts on cholesterol medication? There's a belief that we need to lower people's cholesterol. That's the problem. That's the cause of heart disease. Where's your stance on cholesterol and cholesterol being at the root cause of heart disease?
well, how much in the way of statin drugs do you suppose the Okinawans, rural Chinese, Papua Highlanders, Central Africa, Tarahumara, how much statin drugs are they taking?
Probably none.
And how much heart disease they have? None.
Very little.
So
Yeah.
if you're not going to change your diet, there's no question that you probably because statins have been shown in people who are stubbornly still eating the American diet that it will, uh, shall we just say, it might slow the rate at which you develop your heart attack, but it doesn't protect you from having disease progression, and so they get tougher and tougher versions of the statin drug, and lower the cholesterol more, and still the disease is progressive, even with these newer drugs. But there was a study recently, actually last summer from Spain, that was rather provocative. Actually, there have been two. But the one I'm speaking about is one that had about 5,000 people. These are all men who had a previous heart attack, who, when they checked for inflammation with a test called a CRP, their CRP levels were elevated, meaning that they all had some degree of active vascular disease going on. And then they divided them into a group that was taking a very, very strong, powerful immune suppressant drug to get rid of inflammation, and the rest were placebo. And at the end of 5 years, there was one group taking a modest dose of this anti-immune drug that had a significantly fewer number of new heart attacks, strokes, and deaths. Now, it was fascinating to me to look at that, because in that group where there were fewer heart attacks and strokes and death, the LDL, the bad cholesterol, was not even dropped at all. None. It stayed the same. So what that study clearly showed was how much of an inflammatory component there is to cardiovascular disease. It's not just cholesterol. It is inflammation. Now, the sad thing about that study, and actually a good thing in a way, because the drug, all the benefits it had by decreasing deaths from and heart attacks and stroke, were offset by the fact that it was such a strong immune suppressant that these people were dying of sepsis, infection, pneumonia, and so forth. Mm. And it cost $200,000 a year. So why isn't it? I mean, my reaction to that was, why isn't it a lot simpler to give those patients who have the heart disease and the inflammation the strongest anti-inflammatory agent we have in our box, which is whole food, plant-based nutrition? Nothing takes away inflammation as powerfully or as rapidly as whole food, plant-based nutrition. But the point of my bringing up that study is, think of the benefits that came from getting rid of the inflammation. So if you've got a tool in your toolbox that not only helps to lower cholesterol, but helps to reduce inflammation, and you can do it without $200,000 per dose, because it doesn't cost a thing, because you've got to eat, and in addition, there's not the horrible side effects of dying from some other cause that the drug produces. So it's really rather fascinating. The other studies that we haven't mentioned, I think, are important to allude to, and that is how generally throughout the population is it manifested that there is going to be subtle development of heart disease. For example, in the Korean conflict, when we autopsied our young GIs, average age 20, who had died of combat, at autopsy, 80% of these young men already had gross evidence of coronary artery disease you could see without a microscope. Not enough to cause them to have cardiac events yet, but there the disease was already getting a foothold. 45 years later, that study was repeated, this time looking at young women and men between the ages of 17 and 34 who had died of accidents, homicides, and suicides. And now the disease is ubiquitous. Everybody. You graduate from high school in this country, you get a diploma, and you also get the foundation for heart disease. Again, not enough to have your cardiac event yet, but think of it. You keep eating the same way through your 20s, 30s, and now you're into your 40s. And from there on, you start seeing these cardiovascular events, heart attack, stroke, and death from this disease that they've been developing since they were in childhood. Because you see, even as children, when they start eating that list of foods that I mentioned, the oils and the meats and the dairy and the sugar, they've been, even with autopsy are those sad kids who die at the age of 12. They've already got early evidence of heart disease. So if anybody who is listening to this program who is over 17 and they've been eating the Western diet, they have a foundation for coronary artery disease.
Absolutely fascinating. But you mentioned that when people go on your diet, they also their blood sugar returns to normal. Their autoimmune conditions resolve. Their digestion resolves, and you're seeing that not just are you creating a healthy heart, but you're creating the foundation for health in general. And so that's because I cannot believe the numbers we have that 1 in 3 people in America are diabetic or pre-diabetic, and it's completely on the rise. And that too, they're linking diabetes very closely with cardiovascular disease and with dementia later on, because of how inflammatory it is to be eating such a high sugar diet, and also having unregulated blood sugar spikes.
Yep.
Now,
There was one other, actually a Spanish study that recently came out that it was excellent. They looked at some 1,200 uh, men and women who had what we would consider to be optimal risk factors. I mean, their cholesterol, their blood sugar, they weren't smoking, they weren't over, they were of ideal weight, and the everything seemed to be right in the range that people would consider acceptable. And they decided to carefully study them. They were between the ages, I believe, of upwards of 55 to 60. And when they carefully studied them, they looked at their carotid artery, they looked at the arteries in their heart, they looked at the aorta just below the kidney arteries, and then they also looked at the iliofemoral arteries. For your audience, that's the top of the leg. And when they carefully studied them, 49% of these people with ideal risk factors already had evidence of disease. Now, obviously, they were eating the typical Spanish diet, lots of olive oil, lots of meat, lots of dairy and cheese. But although they happen to have nice numbers, the point I'm making is that it's not the numbers. It's what no number has ever caused disease. What causes disease is what is passing through your lips every day that is going to injure the capacity of your endothelial cells to make nitric oxide. That's what I started with 40 minutes ago, and that's still the case. So it's really quite provocative for somebody to say, well, my cholesterol's fine, I'm going to continue to eat all this meat or what have you. No, it's what is passing through your lips every day that injures endothelial cells that determines whether you develop these blockages and plaque, because you have destroyed the ability of the endothelial cell to make the great protector, which is nitric oxide.
fascinating. Are there medications that also will decrease our ability to make nitric oxide gas? Like, um, are there medications you say no one should be on? Like, NSAIDs have been known to um, stop our own body's anti-inflammatory mechanism.
Well, let's just make it as simple as we can. If you're living and eating whole food, plant-based nutrition, you won't be taking medication. I mean, name me a medication that doesn't have a side effect. I mean, even something as aspirin. Aspirin is a drug, and it's not high, but there are significant, horrible things that take place if you take aspirin every day. There can be a cerebral hemorrhage into your brain. Not good at all. Horrible. There can be a gastrointestinal hemorrhage, even just as bad. Terrible. And there is a smaller percentage that can get macular degeneration or blindness. So, I mean, taking drugs is really problematic. And the thing that's so disturbing about the medications and drugs that are used in cardiovascular disease. And by the way, I should say that I have nothing but the greatest admiration and respect for the care and compassion and the fund of knowledge of my cardiovascular counterparts. But in all due respect, nothing is more embarrassing to us in medicine to think that here in the West, we have built a billion-dollar industry around an illness that does not even exist in half the planet. And the simple answer to this epidemic is not so simple. It's to simply educate the public. Educate the public so that they will know the lifestyle and the nutrition that is going to protect them from having chronic illness.
I like that you brought up the side effects of even something as seemingly innocent as aspirin. I have a family member whose cardiologist has him on daily doses of aspirin, because he's had a cardiovascular event, and it as a preventive measure. And so it's kind of blows my mind that some cardiologists are still in the dark ages when it comes to
Well,
helping their patients.
what happened? You have to remember that medicine today is giving almost zero nutritional training to doctors in medical school, and cardiologists get none of it in their postgraduate training. As a matter of fact, it was just 2 years ago that I was asked to join the nutrition committee of the American College of Cardiology, which I've been pleased and happy to do. And obviously what we're trying to do is we're trying to slowly turn the Queen Mary around here. We want to get cardiologists to be savvy and updated about this. But another thing is that we can't be too flip about this, because when you are going to ask patients to make a lifestyle change, there's probably nothing that is going to be as significant in their encounter with a physician as when they ask them to make a lifestyle change, because that is never going to happen in a 10 or 15 or 20-minute office visit. As a matter of fact, when in my practice at the Cleveland Clinic, where I work as a consultant, and I direct the cardiovascular disease prevention and reversal program at the Cleveland Clinic Wellness Institute, once a month I see usually no more than 10 or 12 patients, always with their significant other or spouse. And they are patients who have had cardiovascular disease. They've either had a heart attack, they don't want another one, or they've been told they have to have a stent or a bypass, they don't want to have it, or they've had one and they don't want to have another one. These patients we see for 6 hours. It's a one single day. Since the majority, far and away, the majority of my patients are coming from outside the state of Ohio, they can't come from California, Texas, or Florida to Cleveland for days at a time. Therefore, we are going to show them in one single intensive 6-hour seminar exactly how it is that they created this disease, and precisely how we are going to empower them as the locus of control to halt and reverse their disease. And in addition, everybody receives a very hefty notebook, which has in it a copy of every one of my PowerPoint slides, several of our scientific articles, a 44-page handout with many additional recipes, which add to the 240, which will be in the 2 books that we provide. And there's a marvelous woman with 30 years experience who experience in acquiring and preparing plant-based foods, dealing with reading ingredients, travel, and restaurants. And then everybody who attends is going to receive a DVD of the entire seminar that I filmed from an earlier one. So should they go home and get rusty or forgetful, they can put this on and get themselves back up to speed. And then everybody is going to hear from 3 local or regional participants who previously had a successful experience, who share their story, so that those in attendance can say to themselves, listen, if he or she can do this, I can do this. Then we answer all questions, have a delightful plant-based luncheon, and then stay in touch as necessary through email or phone call. And these patients really now are going to be, as I say, they're going to be empowered to stop their disease. Because when you think about it, if I spend in front, now, let's just say that, let's grant the fact that these patients all have a reasonable degree of intelligence. And if I spend an hour on the endothelial cells, letting them absolutely unequivocally, in no uncertain terms, understand that the reason that they are there with heart disease is because they have so sufficiently trashed, injured, and compromised the capacity of their endothelial cells to make nitric oxide. They simply didn't have enough to protect themselves from having this heart disease manifest itself. How many of those people, after they've heard about this for an hour again and again and again and again, are going to be able to leave and ever dream of wanting to eat anything that is going to further injure their already train-wrecked endothelium? We want it to recover. And that's why I keep emphasizing, I do not have a program that is 85, 90, or 95%. I don't know whose program that is. If it's somebody says, Dr. Esselstyn, you'd be proud of me, I'm following your program 90%, and I'll just tell them right to their face, that is not my program. You are still destroying further your endothelial cells. I don't want that.
I love it. I love that you're very clear, and this is a very clear cut, very clear boundaries. This program allows us to understand clearly what we're putting on our plate and what we're not putting on our plate. This whole concept of not eating animal products, I've interviewed so many experts on it that my husband and I decided to go for it. And after a few days of cooking a plant-based whole foods diet, we'd started at the beginning of January. My husband said, I'm never eating animals again. I could not believe how delicious this food is. If you had told me that a plant-based diet was this delicious, I would have done this years ago. And he was the typical 3 servings of meat a day kind of person. And now he's just never wants to have an animal on his plate again. And it's so cool because, men and women alike, we can change, and we need to do it with the carrot and the stick. The carrot is the food will be delicious. It will be great after have a little small period of adjustment. But I like that you go fully into it, that you go cold turkey and cut out all the cold turkey and go full into it, because it's very difficult to ease into something like that slowly. Just cut it out 100% and go for it. How soon after following your protocol in your book do people start to feel a difference? I know you've worked with people who are incredibly ill, on like knocking on death's door, but how soon do people start to notice results like a blood pressure returning to normal, or just feeling a general feeling of well-being? Is that weeks or months? How soon can someone start to notice that they're feeling better on your program?
It's interesting, with patients with chest pain and angina, that's probably the most dramatic, because often, literally within days. I mean, there's a gentleman that I tell his story in my book, who was in his early 50s, and he loved entering these triathlons. And he was a triathlete, and he began getting more and more chest pain, to the point where he had to curtail his training, and then he was getting chest pain if he just walked to the mailbox. So he was all set up to have bypass surgery in a couple of months, but I saw him at the same time and he was just a smart, smart guy, and he just totally got this. And within 10 days, he now could walk to the mailbox without any discomfort. He canceled his surgery, and sure enough, his, he's now back doing triathlons.
Oh, I
No
love
surgery.
that. I love that. I
Yeah.
love that we can prevent surgery. Surgery, is great to have in our pocket as a tool, but really as a last resort. And if we could turn our health around, using natural medicine that's going to get to the root cause, then that is the absolute best avenue. I'm so thrilled that you discovered this. Was there an aha moment that you had, like when you realized that the diet, when you made that connection? When you were like looking at the Okinawans, for example, and the diets around the world where there was no cardiovascular disease, and going, what is it about this diet? Was there an aha moment that you had where you realized it was the nitric oxide that was being inhibited?
Well, actually, when I started this, nitric oxide hadn't been invented yet. We were just sort of mimicking the the nutrition from those cultures where cardiovascular disease was virtually non-existent. But now we understand a lot more about the mechanisms of how it was that these plant-based diets were actually working. But the moment came pretty much when within about, I would say, I think it was within about 12 months of starting our program, one fellow who, in addition to his heart disease, had a blockage, partially blocked artery in his thigh, such that when he was walking to my office over the Skyway, he had to stop 5 times because of pain in his calf muscle on his affected side, and he had to wait till these small arteries were able to give him enough blood in his calf muscle so he could walk another 25 yards. And but I was so focused on his heart, I forgot all about his leg. And when we first saw him, we did a measurement at his ankle of the strength of his pulse, and it was what you call a pulse volume measurement. So, in 11 months after he'd been with us, he said, Dr. Esselstyn, do you recall when I first started seeing you, I was stopping, crossing that Skyway 5 times because of pain in my leg? He said, the last month it got to be 4 times, then it was 3, then it was 2, then it was 1. He said, I don't stop anymore. The pain is gone. I said, Don, back you go to the vascular lab. And we repeated the pulse volume, and it was now double what
Wow.
we had at baseline. And this was a eureka moment because we now knew that food and food alone could absolutely halt and reverse cardiovascular disease. Now, somebody might say, well, wait a minute. Wasn't this statin drug there? Look, in 1986, when we started this, there were no statin drugs. And time after time, we have patients who come to our program because they can't take any statin drugs. The side effects are just too severe, either for their liver or for the neuromuscular pain that they get. Some of them get diabetes from it. Some of them get brain fog. But even those who are unable to take the statin drugs, if they will follow this program, they absolutely are. In no ways are they precluded from enjoying the same benefits.
Absolutely fascinating. Oh, that is so exciting. Let's talk a little bit about your books. You mentioned that you have a cookbook. I see that, the Prevent and Reverse Heart Disease cookbook, and it looks delicious. Um, and you've talked about how
Uh,
that whole grains can be part of the diet, but that because we want to avoid sugar, animal products, and oil, that really leaves out a lot of processed foods, like even the vegan breads out there will contain oil. Do you have a way that people could make their own bread, or should we just stick to like oatmeal and porridge and a whole eating grains as a whole grain on our plate?
we suggest that the patients eat Ezekiel bread.
Oh yeah, sure. The sprouted bread.
No, it doesn't have to be that. I mean, it is, but I guess what I'm trying to point out, it doesn't have any oil or too much in the way of any salt.
Got it. And what should we know about your cookbook? it obviously has some delicious recipes. Are there any recipes you'd like to share with us?
Well, I just my favorites in the morning. I always have oatmeal with some raisins, banana, and raspberries, blueberries, strawberries, and blackberries because they are terrific. Then I often will have a soup. Anne makes a soup that you can almost walk on. It's so filled with vegetables. And my favorite at supper would be either beans and rice or a stir-fried grain that we can have with many different types of vegetables. Or you can even have a cheeseless pizza. You have to be a little careful with the crust. And we get that from Sammy's
Got it.
bakery or out of Engine 2 makes another crust.
Yeah, I've seen that engine to those products at Whole Foods.
My son,
Wonderful.
yeah. Uh, the other point I think that deserves to be made is that when somebody will say to me, Dr. Esselstyn, don't you think that your diet is a little too extreme or severe or strict? And I'll say, well, there's no question that our diet is significant. But let's be clear about one thing. The most severe, strict, and extreme diet today on the planet is the one that 97% of Americans are eating every day that is going to guarantee that before they perish, they'll have some hideous chronic illness.
Mm, it's so true. Eating food like substances. Our diet is just filled with artificial food and chemicals, and it's really just void of like you said, the orac in all of the wonderful vegetables. We're just not eating enough of all the foods that heal and build a healthy body. Um,
Yeah, you don't want to eat out of a box, a bag, or a can. What you have to start reading a lot of ingredients. Then you've really got to be so careful because food that is processed is really going to be problematic. When you walk into your grocery store and you go to the produce section and you look at bok choy, Swiss chard, kale, collards, collard green, beet greens, mustard greens, hey, there's no list you have to read. There's no ingredients. You just pick them up and you're off with them, and they are as safe as you can be.
Now, what about age? Have you been able to help people in their 70s or in their 80s, or even older, reverse disease like
Yeah,
heart disease?
my oldest patient is 95 now.
And so someone who's a senior, because I think sometimes people think, oh, I'm too old. I'm too old to reverse this, or I'm too old, or
Oh no,
any age can do this diet and see immediate benefit. Like you said, within 11 months, that patient was able to gain the vascular flow back to their calf after that having that blockage for so long.
or the one who got relief of their angina in 10 days. I
Right,
mean,
10 days, exactly. That's amazing. I
that
love
is,
stories like that. It has been such a pleasure having you on the show. Thank you so much for coming and sharing this. The link to both your books are going to be in the show notes of today's podcast at learntourhealth.com. We'll make sure that all the listeners get those links so they can buy your books. I think everyone should buy Prevent and Reverse Heart Disease. I think this is one of those books we should always give out as birthday presents, as Hanukkah or Christmas gifts. I think everyone should have your book in their household because this is something that can completely revolutionize the all disease. And so I love that you've been preaching this since the 80s and finally people are catching on. You're welcome back on the show anytime you want to come share more information about this topic. It has been such a pleasure to have you here today.
I have one final comment, and that's you see, if we are going to truly be on the cusp of what could be a seismic revolution in health, this seismic revolution is never going to come about with the invention of another pill, another procedure, another operation. The seismic revolution in health that is going to come about in this country and the West will be when we in the medical profession have the will and the grit and the determination to share with the public what is the lifestyle, and most specifically, what is the nutritional literacy that will empower them as the locus of control to absolutely annihilate chronic illness. Thank you.
Do you have supplement confusion? Do you wish you could speak to an expert and figure out what you should take and why? If so, then you'll definitely want to go to takeyoursupplements.com because they let you speak to a holistic health coach for free. TakeYourSupplements.com health coaches have been helping people gain their health back and dial in their supplement protocols for over 20 years. Our health coaches want to help you gain your health back naturally with the best holistic medicine. They work with the highest quality vitamins, minerals, and herbs to support you in increasing your health and achieving your fitness goals. More energy, mental clarity, balanced hormones and blood sugar, better sleep, stamina, fertility, immune and digestive health. The list goes on and on. Natural medicine gives your body the raw building blocks it needs to create new healthy tissue, repair, and heal. Everyone who supports their body's ability to heal itself with the right natural medicine protocols feels and sees a substantial positive shift in their well-being. So if you want to feel and look healthier, go to takeyoursupplements.com, fill out the form, and one of our amazing, highly experienced health coaches will speak with you for free and help you order the right supplements for you at the right price. They help you to order directly from the manufacturers, so the savings are passed on to you. Plus, there's a 30-day money-back guarantee, so you know you will get results or your money back. These are the exact same supplements that my husband and I have been on for 7 years, and the same supplements that we give to our child. I love these supplements. They really work, of course, alongside a very healthy diet, which another benefit of going to takeyoursupplements.com is you will have the aid of your health coach who will help you dial in your diet and your supplement protocols to help you gain your health back and gain all of your health and fitness goals. So it's really a win-win situation for you. Visit takeyoursupplements.com today and try them out. Give them a try and see just how amazing you feel with their help. takeyoursupplements.com.